going to be discussing on how we've been embedding social care in community college settings through a mental health navigator program. Let me see if I know how to work this. Yeah. So this project is being funded currently by the Alameda County Behavioral Health Workforce Development, Education, and Training Division. So shout out to them. Who are we? And feel free to tell me to slow down, but I'm a quick talker, and I know we've heard that a lot this morning, but sometimes we feel like we have to run with the clock. But our Mental Health Navigator program is a collaborative initiative within the California Community College system, which started in 2020. And the program addresses the limitations of short-term campus-based resources and the limitations of also thinking of how we can provide support to the students. So we're using a peer-to-peer model to support the students. The peer navigators, who are students of the colleges themselves, assist their peers in connecting them to health services, mental health, basic needs. When this program started, I do remember, I started 4 years ago, and again, this program started in 2020. It's been in a pilot program for 5 years now. But, you know, I'm not even gonna say post-pandemic right now, but, hold on. Oh, thank you. Can you hear me now?
Yeah.
Great. Okay, no pressure. Where was I? Okay, so when as you can see, it started in 2020, so it was like in the beginning of the pandemic, and we all know how that was. And, you know, as the years progressed in the program, we started seeing the need of college students, you know, lacking that support, and especially when it comes to mental health and their social care needs. So this year, again, is our 5th year as a pilot program in the Alameda County College system. And the way it works is that we recruit students from each community college to work for their health center as mental health navigators. The participants engage in robust training, and by that, we'll talk a little bit more in a little bit, but we like to connect them to community agencies through doing showcases. So we like to collaborate with our community agencies to leverage those resources already there, because as we know, the system or the resources on campus are very limited. And lastly, our participants navigate and health insurance coverage and linkage to off-campus services, like I mentioned. So this is what it looks like. This is a map of Alameda County and where each campus is located. When this program started, it started with, here, I'll show you this. We have Berkeley City College, Chabot College, College of Alameda, Laney College, Las Positas, Merritt, and Ohlone. And you can see the trajectory of the 5 years and the participating colleges. This is our first year, 2024-2025 cohort, where we got all 7 campuses to participate in the program. So we're very grateful for that. Thank you. Yeah. And we're very excited because each campus doesn't just have one navigator. Some of them have up to 3. So depending on the capacity, again, because it is Alameda County funded, you know, they have the option to hire more than 1. But as you know, sometimes they don't have the time to like mentor them. So some of them do only have 1. So when we're thinking of why this is needed, right, like the student referral process, or at least the ideal one, when students came into the health center looking for mental health services, we have to assess them, right? Are they in crisis? Are they not in crisis? And I'm not going to go through this whole model, but thinking of what are the steps that are needed to take care of the students when they are struggling mentally. And then when we look at the social care aspect is behind all of that, what is affecting the student. And, you know, we'll get into a little bit more about when it comes to that, you know, how are they able to thrive as students? How are they going to be able to get the support they need if they're struggling with all these other social care aspects? So again, I know it's a little bit chopped, but education, health, and basic needs. I personally think that this is what makes a person. We're talking about whole person care. And it's not that, you know, education's more important or the health needs to be there in order for them to receive the education or to excel in their education. It's about having those basic needs to keep them healthy in order for them to be thriving in education. This is our 2023 and 2024 impact, mainly because our 2024-2025 cohort is still in progress. But when we're looking at the total number of assigned cases, we had 61 cases, but I want you all to look at the proportions of the amount of students that were seeking counseling services. And these are not students that are actually served in the health center. These are students that were referred out into the community. So the next aspect is looking at insurance coverage. We all know that, if we're looking at traditional age, 18 to 25, I would say, traditionally, college students, are they prepared to understand what insurance looks like, right? Stepping out of your parents' insurance, going into even applying for the services or sometimes the medical insurance that the college offers or other programs, or even looking at Medi-Cal or Medicare and how that, the stressor of all of it. So we have been supporting students at a 69% in that year in connecting them to insurance, whether that's with Medi-Cal or with a social worker that's able to help them even apply for all the other programs like CalFresh, CalWorks, if they qualify as parents, and all of that. And lastly, housing. Housing is a can of worms I'm not gonna open right now, and I think it's very limited because, again, these are student workers, right? They don't have the expertise and they're not aware of all the programming in the community, but we're effectively working really hard by having those community agencies and building those partnerships with the 211 in our county, and also doing those one-on-one, essentially like case management cases, right? When we have those students and we call with the student to make sure that they get connected to someone, whether it's getting a shelter or getting an address or getting a voucher for subsidized housing or even applying for the subsidized opportunities in Alameda County. And lastly, this is a number that still bothers me, 67% the proportion of clients that are actually connected. I'm gonna say that's probably higher, but again, this is based on self-report, right? So when we're looking at how many students actually connect, it's like pulling teeth and nails sometimes, emailing the students do you need more support? Did you reach the services? But at least we know that a lot of them are reaching out to those services, which we're still grateful for. Okay, so we're looking at the methods now when we're thinking of how students can actually do the work in the health centers. Again, because they are students, they're also still having their classes, they might still have a part-time job. But we wanna make sure that they have the essential training to be able to do the work for their peers. We start with, I know it's a little bit chopped off, but we have what we call wellness academies, where it could be between 4 and 5 days, full days, where they get mental health first aid training, which is an 8-hour training day to get certified. We also have suicide prevention training with the county. Also, again, the community agency showcases, and we had started with agency visits. So we called agencies and we're like, we wanna know what this looks like. If a student was to be sent to you as a referral, we don't want them to feel discouraged, right? And as a person that has been on that end, I want to make sure that these students are not either turned away or thinking that they have to take this long bus ride and then what? It's closed, right? So we want to know what it looks like as they're walking in. So that was important. Looking at case management, again, we're not social workers, we're not licensed clinicians, but we wanted to make sure that we tackle this, and this was also based on what the navigators felt they needed. They're like, I want to know what it's going to take as a student myself to be able to help up here. So we're looking at navigator case management on mental health and basic needs. So we do one-on-one trainings where they get to work with another navigator and they get to discuss or pretend to be a client with a basic need of housing, health, mental health, signing up for health insurance coverage. And that's been a positive it's been a positive outturn because the navigators have commented that they really benefit from having that experience, even if it's not with a real client. They feel prepared to take a client after that. We do have currently, that's changed, it's weekly cohort meetings. They change by semester, because if you're familiar with the community college system, the schedules change. So we always try to make sure that we're available for the students to have those cohort meetings and to do trainings during those cohort meetings as well, but to be consistent, because we already know that mentoring is what's important when we're working with a workforce development program. And again, the learning collaborative. We encourage the students. We have something called teach back moments, right? Because if you know the community college system, Not all students are from a traditional age. A lot of them have lived experience, which is very essential for this type of work. So we encourage them to come in and do some other trainings, or like, what do you have to teach us, which is great. And lastly, mentorship and social support. A lot of the programs in Alameda County that are related to mental health have the opportunity to sign up for a scholarship. I'm not going to get into that one, but this is where the mentorship and also social support comes in, because aside from that, we do one-on-one trainings and check-ins, but we also have social events for team building, and again, the teach-back sessions. So this is something that we can look at what the feedback of the students is at the beginning. Well, actually, this was at the end of the last cohort, which was 2024. When we see the light blue numbers, that's when they started, and the dark blue numbers is how they finished. They're indicating their familiarity on following the subject matters, which are the U.S. healthcare system, the confidentiality and mandatory reporting laws, continuum of care model, the community mental health system, healthcare options, whole person care, war handoff, which is very important in community work. And then another slide that I like to show you is the students' level of confidence when it comes to mental health communication and support. So all out of our navigator cohort, I would say this year 87% is actually in the, or looking forward to being in the mental health system, which is very beneficial because they get the training in this program. But a lot of them are biology majors, right? So even those biology majors get to experience what the health system looks like as a whole, and it's, you know, it's very much appreciated. But you can see here in the light green numbers is how they started. The green numbers is how they finish, which is, you know, they're very confident about these topics, like discussing health insurance options with students, talking about mental health services available in the community, and also contacting health and mental health care agencies, which we all know sometimes that takes hours. This is some challenges that our navigators have commented, and that was that one of the most challenging aspects is navigating the different health insurance that clients have, because a lot of them are very, you know, they are grateful to have that private insurance, but for us to navigate that, it's like, oh, I actually need you to call, but we'll do it with you. And also wanting to know or get confirmation of the resources I sent to clients were utilized or helpful. We have experienced that, and I mentioned it earlier, but looking at the rewards. The most rewarding aspect of hearing back from clients who tell me how grateful they are for helping them find resources or navigating confusing mental health. So it's not only rewarding for the students, but it's also that peer-to-peer model that they feel more social connectedness on campus, and also feeling more rewards as far as like doing the right thing or knowing that you're supporting your peers. I don't think if I want to get into this, but yeah, we talked a little bit about the benefits. So looking at improved access to care, fostering academic success and well-being, and workforce development in mental health. Lastly, the dual impact. So the program supports students' academic achievement by addressing their well-being and cultivates the next generation of professionals in mental health, and understanding that we can bridge between resources and students, and you know, all the things. I mean, I can speak from personal experience. I'm a late bloomer. I just finished my bachelor's a year ago, so I'm like, thank you. So thinking of as a mom, as an adult, and still not understanding a lot of these systems, well, now that I have been grateful enough to be part of the program and supporting other students that might be in the same shoes or even younger, it's like, it's very essential work to be doing in the community college health system. So thank you. If you have any questions.